Hi, I'm Rae and I have IIH. I will be explaining to you what IIH is, and I have some notes for that. As I go on explaining what IIH is, you will understand why I have notes. So, what is IIH? IIH stands for Idiopathic Intracranial Hypertension. It's also called Pseudo Tumor Cerebri or Benign Intracranial Hypertension. IIH is a disorder that's characterized by high pressure on the brain as a result of increased cerebrospinal fluid. Cerebrospinal fluid, or CSF, is the fluid that surrounds the brain and the spinal cord. CSF is usually reabsorbed into the body, and if it's not, then it builds up. IIH can be classified into three categories. Those three categories are acute, which means that symptoms have a sudden onset, and it's usually as a result of a stroke or some head trauma. Then there's chronic. Chronic, that's where your symptoms develop over time, and it's usually because of some underlying health issue. Then the third is idiopathic. Idiopathic means that there is no known cause. I have idiopathic intracranial hypertension. There is no known cause for me having this. IIH causes symptoms of a brain tumor without the presence of one. So some of these symptoms include, but they're not limited to, changes in vision, loss of vision, especially peripheral vision, dizziness, vomiting, nausea, trouble walking, severe headaches, which is one of the main symptoms, tinnitus, that's a constant ringing in the air, forgetfulness or memory issues, hence the notes, hearing issues, and depression. Experts are still unsure as to what the true cause of IIH is, but certain medications have been linked to this disorder. Some of them are like birth control, especially the synthetic birth control, certain antibiotics, even some acne medications, chemotherapy drugs, and steroids, some steroids also. Anybody could develop IIH. It's not limited to just one group of people. But certain groups of people are at higher risk for developing IIH. These groups are women of childbearing age, that's from the age of about 20 to 45, persons with thyroid conditions or kidney failure, chronic kidney failure, and overweight people. How is IIH diagnosed? It's actually diagnosed through a process of elimination. So when you have your symptoms, your onset of symptoms, a host of tests are run. MRI is a main one. The most common one is spinal tap or lumbar puncture. This is where they insert a needle into your spinal column and test the pressure with a gauge. They test the pressure of your cerebrospinal fluid, and they also extract some and take some for testing. They test for meningitis and other diseases. They also do eye exams because when you have pressure on your brain, usually your optic nerve gets it's squeezed by the pressure in your brain, so that they would do eye exams to see if there's any swelling of the optic nerve or the optic disc, and that's another way they would diagnose IIH. So like I said, there is no cure, no known cure for IIH. But there are treatments. Treatments include weight loss if necessary, because not all people with IIH are overweight. There are surgical treatments, which include inserting a shunt into the brain to release fluid, to drain the fluid out of the brain. Spinal taps, as I mentioned before, which would remove the fluid also. Medications such as diuretics, also to remove extra fluid. And optic nerve surgery to save your vision when it gets to that point. If untreated, IIH can lead to total blindness, total vision loss. It can also lead to possibly strokes. IIH is an invisible disorder. That means that you don't see it. There's nothing physically that you may see on me that would tell you, okay, that person has IIH. It's all internal, and it is a very painful disorder. The head pain is severe all the time. I will be explaining more about IIH because I would like to raise awareness on this disorder because it's very rare. IIH affects 1 in every 100,000 people. I know only of one other person in this country. I'm sure there are others, but I only know of one other person in this country with IIH, and that person has a shunt. So it was very severe. I fortunately do not have a shunt. Mine is pretty well managed with medication. Over the course of these videos, I will explain the different medications I'm on and basically how I live with this disease, how I survive with this disorder. So stay tuned, and I really hope to encourage others to find out more about IIH and to bring awareness to it. So I would like to leave you with some words. And it's very simple. Smile. You survived. So, like I said, stay tuned and see you soon.